Did you know that one simple blood test can reveal anemia, infections, immune problems, and even possible cancers? That test is called the complete blood count, or CBC. Doctors request it almost every day, but many people receive the results without understanding what the numbers actually mean. In this video, I will explain what CBC is, the normal values, what happens when the results are too high or too low, the symptoms you may experience, and what you can do to improve your health. A complete blood count, or CBC, is a laboratory test that measures the three major types of blood cells. These are the red blood cells, white blood cells, platelets. Each one has a very important function in the body. Red blood cells carry oxygen. White blood cells fight infections. Platelets help stop bleeding. By analyzing these cells, doctors can detect many medical conditions early. Red blood cells are responsible for carrying oxygen from the lungs to the entire body. They contain a protein called hemoglobin, which binds oxygen. Normal RBC count. Men, 4.7 to 6.1 million cells per microliter. Women, 4.2 to 5.4 million cells per microliter. If RBC is low, this condition is called anemia. Common symptoms include fatigue, shortness of breath, pale skin, dizziness. Possible causes are iron deficiency, blood loss, vitamin B12 deficiency, chronic disease. Remedy or treatment. Treatment depends on the cause, but may include iron-rich foods, spinach, red meat, beans, vitamin B12 supplements. Treating underlying diseases. Hemoglobin. Hemoglobin is the protein inside red blood cells that carries oxygen. It is one of the most important values in the CBC. Normal hemoglobin values are: men, 13.8 to 17.2 grams per deciliter. Women, 12.1 to 15.1 grams per deciliter. If hemoglobin is low, this usually indicates anemia. Symptoms may include fatigue, dizziness, fragility of hair, insomnia, irregular heartbeat, cold hands and feet, muscular weakness, pale skin, headache, nail changes, dry skin, dyspnea. If hemoglobin is high, the possible causes are dehydration, living at high altitude, lung disease, and polycythemia. Polycythemia means there are too many red blood cells, RBCs, in the blood, and CBC shows high RBC count, high hemoglobin, and high hematocrit. Remedies are adequate hydration, balanced diet, medical treatment when necessary. White blood cells. White blood cells are the body's defense system. They protect the body from bacteria, viruses, and other infections. The normal WBC count is from 4,000 to 11,000 cells per microliter. If WBC is high, more than 11,000 cells per microliter, this may indicate infection, inflammation, stress, leukemia in rare cases. If WBC is low, less than 4,000 cells per microliter, possible causes include viral infections, bone marrow disorders, certain medications. Symptoms of abnormal WBC may include fever, frequent infections, and weak immune system. Treatment depends on the cause, but may involve treating infections, improving nutrition, and medical management. Platelets. Platelets are tiny blood cells that help stop bleeding. When you get a cut or injury, platelets quickly gather at the damaged area and stick together to form a clot that seals the wound. When a blood vessel is injured, the body immediately activates a protective process called blood clotting. This process prevents too much blood loss and helps the body begin healing the wound. Without clotting, even a small injury could cause dangerous bleeding. The body responds very quickly by activating a series of steps that stop the bleeding. The first responders are platelets, which are tiny blood cells responsible for stopping bleeding. When a blood vessel is damaged, platelets quickly move to the injured area. They stick to the damaged vessel wall. Then they stick to each other. This forms a temporary platelet plug that helps slow the bleeding. However, this plug is still weak and needs reinforcement. In the next video, I will explain hemostasis in more detail and understand how the body controls bleeding and forms blood clots. Normal platelet count is 150,000 to 450,000 per microliter. Symptoms of low platelets may include easy bruising, nosebleeds, bleeding gums, tiny red skin spots, and bone marrow disorders. Possible causes of high platelet count may include infection, inflammation, and bone marrow disorders. Both high and low platelet counts can be related to bone marrow problems because platelets are produced in the bone marrow. But remember, many other conditions can also change platelet levels. Why complete blood count or CBC is important. Doctors request CBC for many reasons. It helps detect anemia, infections, blood disorders, and immune problems. It is also used to monitor patients undergoing treatments like chemotherapy. Chronic disease management, bone marrow disorders. This is why CBC is one of the most commonly ordered laboratory tests in the world. In summary, the complete blood count measures red blood cells, white blood cells, platelets. Together, these values provide a powerful overview of your overall health. However, abnormal results do not always mean serious disease. Sometimes changes can be temporary due to dehydration, infection, stress. Always consult your doctor for proper interpretation. If you want to understand blood tests and laboratory results, subscribe to my channel. I will continue explaining laboratory tests in simple and practical ways.